Hi, my name is Bailey Wood. I'm the Manager of Fundraising and Marketing at CenterPointe. I'm here today to talk with some of the CenterPointe staff about mental health and well-being, our crisis response services, and how we're creating a stronger community. I'm here with Topher Hansen, the CEO of CenterPointe. Topher, what has COVID taught us about mental health and well-being?
Well, it certainly has taught everyone that they have mental health. We all have it. The question is, what condition is it in? And it's taught us about how to care for ourselves in ways we may not have ever faced before. For the vast majority of people in the U.S., I think the COVID pandemic has, and the isolation, the restricted movement and things like that have caused everybody to re-examine how they operate in the world and how they need to take care of themselves. So what I think it has taught us is that we can't take this for granted. This is an organ just like my heart and lungs and tissue and all those things are organs. And it gets sick too. And when it's under extreme circumstances, it'll get pushed to the point of some illness, really. And that's the anxiety and depression and things like that can rise out of those circumstances. So probably what it did was foster an environment that told us all that we need to be more intentional about caring for ourselves, and that if we're going to have mental well-being, emotional well-being, then what we need to do is act on that and be intentional about caring for it. So that can be where your sleep patterns are the same. You go to bed at the same time, you get up at the same time. You have a routine prior to bed. During the day, you get some exercise. You go out on a walk, and the more you can get into nature, the better. The evidence around the fact that nature gives us a lift is replete with solid data. And so knowing about how to care for yourself with exercise, the fuel that you eat, good food, the sleep that you get, not using alcohol in excessive ways or other substances to help mute some of the feeling that might be coming up. So COVID has really been accentuated the environment that we're in and the stressors that we have. And our crisis response team had exponentially greater responses in phone calls, in walk-ins, in outreach with the Lincoln Police Department, and the mentioning of anxiety and depression just skyrocketed. So we know that this pushed everybody. But just like the fact that I can sit here all day long and want my bicep to be big, but if I don't sit and do this, it's not going to be. And so in the same way, we've got to take care of our brain in the ways that it needs help to really stay balanced. And there are many things to help achieve that, but we have to do it. We have to be intentional about it.
Thank you so much. One of the things we talk about a lot at CenterPointe is how mental well-being is essential for strong communities. Can you tell us a little bit about how CenterPointe works to create a stronger community now and into the future?
You bet. So mental well-being is that place where everyone feels satisfied. You feel happy, and happy's kind of the bottom line. I'm a big happy guy. So the Dalai Lama says the purpose in life is to be happy. And there is a lot of study out there on happiness and mental well-being. And so to do the thing, if everybody does that, think of your environment. If everybody in your environment is really happy, what a great environment. But think of the opposite. If everybody's sad, that's a hard environment to be in. So we all want to find things that help our individual selves, our group, and our community be happy. It's a very complex answer, but we can all take strides that way by doing things that help keep us happy. So you can read a book called Happiness Advantage. You can go sign up for online for free the course, The Science of Well-Being by Laurie Santos. A great course that teaches you about this. You can listen to Laurie's podcast called The Happiness Lab that she talks about these things. So all those kinds of things start teaching you about how to be happy, and then what CenterPointe is doing is providing services when people feel in crisis that we can help them start to move down the road that way. When they need treatment, we can provide treatment. So we have a large outpatient program that does mental health and substance and primary care. We have residential programs. We have over 40 services between Lincoln and Omaha to provide care to people. But more so, we're even doing things like working with elementary school kids on mindfulness. So to learn how to be mindful and to emotionally regulate when you're at a young age, and kids easily get this. I've seen 4-year-olds who really, when it's put in 4-year-old terms, really understand how to be mindful and how to regulate. So we can all work that way, and CenterPointe is here for when things don't go so well, but we're also here to help people figure out how to be well and to emotionally regulate, to be mindful, and to really take care of their emotional well-being needs. And again, our whole philosophy is on that approach, a positive approach to our mental health and our physical health, and to have our sights pointed on the positive star out in the future that is about emotional well-being and about physical health. That's a positive, strong goal for each person. So we want to participate. We want to be the place that people can look to for good information about how do I get emotional well-being, how do I help get myself healthier. We can do those things, and we can also help when things aren't so good and there's a crisis or other treatment is needed.
That's great. I love that CenterPointe is investing in the future of mental health by teaching those skills to younger kids. That's awesome.
Yeah, it's anxiety and depression are the largest illnesses in fact, in terms of what it costs society, it costs more than anything else. It is the #1 cost burden, not only in this country, in the United States and Canada, as well as countries around the world. So this is one of our giant pandemics, the illness of the brain. And the COVID pandemic pushed the brain to a point that it hadn't been before. And that's where doing things like mindfulness and emotional regulation and helping on those issues will help the entire community get well.
Well, thank you so much. Thank you for being here today.
Thanks for doing this.
Great.
Yeah.
Thank you.
Yeah.
For more information on CenterPointe and all of our services, you can reach us at centerpointe.org. To reach our same-day service line, the phone number is 402-475-5161. And if you would like to reach our crisis line, our phone number is 402-475-6695.